Thank you, Ronelle. It is my great pleasure to introduce Professor Valeria Raparelli as our next key speaker for this evening. Once again, her professional achievements are numerous, and it will be difficult to do justice to them in our short time allowed. Valeria is both Assistant Professor of Internal Medicine, University of Ferrara, Italy, as well as Assistant Professor, University of Alberta, Canada. Over the past 5 years, her main research interests have focused on understanding sex and gender-specific issues in cardiovascular disease. Valeria was recently awarded the Elizabeth Young Investigator Award from the Organization for the Study of Sex Differences. Her current work as co-leader for the McGill Going Forward project is aimed to establish a global network of experts in gender medicine, internal medicine specialists, and outcomes researchers. Valeria is also co-chair of the Imagine, Internal Medicine and Assessment of Gender Differences in Europe. And from March 2020, she is part of the COVID mortality group of the Italian National Institute of Health, and she is a research partner of the iCare, International COVID-19 Awareness and Response Evaluation Study. Valeria, we look forward to hearing about your key learnings, both in the gender differences seen in your work in ischemic heart disease and in COVID-19.
Thank you so much for the kind invitation and introduction. Today, I'm going to talk about the incorporation of gender variable into research data, a focus on ischemic heart disease and COVID-19. But before starting, please let me acknowledge the great effort that women are putting in advancing science. I have no disclosure. Why am I here? Because I can share with you what I've learned so far about the integration of gender in clinical study. Please watch out my warning sign along the presentation that will deal with methods and measure of gender, and I will provide you practical example in the field of ischemic heart disease and COVID-19. The first lesson I learned is that sex and gender are not interchangeable terms. As opposed to biological sex, gender defines the socially constructed role, behaviors, expression, and identities of individuals. Most importantly, gender and sex are equally relevant for health, meaning that if we are not taking into consideration the gender construct, we are really missing a big piece of the picture. The first hurdle that clinical scientists encounter when they want to integrate the gender in their research is to embrace the complexity and the multidimensionality of gender. As you can see, gender encompasses different domains: gender relation, gender role, gender identity, institutionalized gender. How we can measure such complexity, even though we do not have a standardized method for doing that? Also, as a clinical scientist, we are not used to collect this data. I think that we can improve and do better. Usually, clinical scientists deal with data that comes from two potential scenarios. From a side, you have already collected data sets. From the other side, you can design a new project and you will start to prospectively collecting this information. Which method you should apply for doing that? There is no right answer. What I'm going to share with you today is the answer of the Going Forward network. The Going Forward project I'm part of was founded in 2019 by the Gender Nest plus Horizon 2020 Aeronet initiative. And as you can see, different experts in the field joined an effort from institutions in Europe and Canada with the aim of assessing the effect of sex and gender in clinical cost-sensitive outcome and patient-related outcome across a non-communicable chronic disease. And we want to really find innovative way for integrating gender in clinical studies. At first, we developed a standardized 5-step methodology that you can apply for integrating gender-related variables in assessing outcome if you have already available data sets. I will talk today just about the step number 1 for a matter of time, but just to reassure you that if you want to try to explore the issue of gender in your data sets, you can be guided by this template that we provided, the gender-related variable wish list of going forward, that came out of a 2 days conversation and discussion that we had with all the stakeholders in the field in April 2019. So please have a look at our website. Or if you want to start a new study and you want to assess the effect of gender or your outcome in any clinical field, as usual, the first question is, does gender matter in your research question, in your field? I would say always if you're dealing with human studies, but then the most important before starting is to really have an hypothesis on the relationship between the gender scale and domains and your outcome of interest. And then you can start from there, collecting the new data, and you need to be conscious about the fact that some of the gender-related variables capture the same dimensions. So you need to be aware that you need to follow specific rule for conducting your analysis. So let's talk about that. How do you include the gender-related variable in your analysis plan once you have this information, either retrospectively or prospectively? Actually, you have 2 options. Number 1, you can compute a composite measure of gender. Number 2, you can assess the individual effect that each factor has on your outcome. There is no better option among them. It depends on the richness of your data sets, and it depends on your research question. And I will provide you an example. So this is a landmark study that shows at first how gender can predict better clinical outcome beyond sex. The Genesis Praxis study was a multi-center observational prospective study enrolling young adults with acute coronary syndrome. And what the Canadian investigator did was to depict the gender of each participant. They identified 7 items that could be used to compute the gender score that ranges from 0 to 100. And please notice that the distribution of the spectrum across gender is wide, and there is also a percentage of overlapping. Why is it important to better characterize the gender of participants in this field? Because if you look just at the sex disaggregated outcome, you will see that there is no difference between males and females. While if you look at the gender of your participants, you will see that those males and females that have feminine characteristics according to their gender are those that experience more often adverse events, meaning that assessing gender can really add value in terms of prediction of adverse outcome. Then what I did, I apply the same 7 items of the Genesis Practice Gender Score on my Italian cohort of patients with ischemic heart disease. And I was surprised to notice that the distribution of the gender was different. And so I was thinking that maybe the reason why I had this finding was that really gender, because it's socially and cultural based, can be country specific. And so we need to take it in consideration when we are providing evidence gender-based in terms of transferability of our results. Last example, how we're gonna assess the magnitude of effect of an individual gender variable on outcome. In this case, I will provide you an example related to the COVID pandemic. We have learned in the last year that sex and gender are possible modifier of the COVID pandemic. And there are evidence sex different in terms of infection, progression, and severity of the disease. As going forward project, we want to try to explore a research question that was gender-based. What we did, we used the data tracker of the Global Health 50/50 initiative. We identified those countries that provided sex disaggregated data in terms of cases and death. And sadly, we found only 33 countries. This is something that we should discuss about. Then we discuss about the conceptual framework on how gender-related factors may be related to a different prevalence of the disease among females and males. And we identify those gender variables that might affect exposure and affect testing. How we included the gender dimension in our research question. We used the Gender Inequality Index, which is an index that is provided by the United Nations for each country and is computed based on the distribution of power and labor market or health rights among females and males. As you can see, those countries that have the higher gender inequality, meaning those countries that favor men over women, are also the country with the higher rates of male to female ratio positive cases. How to explain these findings? Is it because of the sex different risk factor, or it is because there is a different attitude in seeking care, or there is a different likelihood of receiving the test when you have symptoms? While we are talking about gender dimension and the need of incorporating gender in our research, because we really want to, as a clinician, to take the leap from a one-size-fits-all medicine to the precision medicine, because we want equity for our patient, equity in the solution that we can provide to each individual, women, men, gender diverse people. We don't want to see anymore a sex and gender blind technology solution for a device, patient or a physician. We want to develop tailored mobile health application that take into consideration the needs of all individuals. We want to foster the education of our next generation of healthcare provider that should be more confident in asking for the gender-related variable when they collect the clinical history of the patient. And we really want to provide evidence that can shape the decision-making strategy for prevention of the diseases, and COVID-19 has thought a lot about that. So I hope that after this brief talk, I convinced you that sex and gender interact and are important for health and disease. I give you one possible solution a framework for dealing with gender-related variable in both retrospective and prospective courts. I really suggest you to assess whatever it is, a composite measure of gender, if you have the lack of a wealth of gender-related factors in your data sets, but also if you just have one information, use it and see how it changes your results. Exploring the effect of gender in clinical study is really informative and can boost innovative solutions in healthcare, and we need them. And now I want to open the discussion on, and just say, reflect with you on one issue. Artificial intelligence is the future also for physicians and for clinical scientists. But the issue is that even if we can improve a lot with technology, our ability of generating algorithms that predict outcome, how we can achieve algorithms that are equitable and that are fair if we do not include sex and gender-related variables for training our machine. So we really need to discuss about that, and we really need to be sensitive to the need of collecting this information in our studies. And finally, let me acknowledge all the funding agencies that support my research work. I have to admit that all I have presented today is the result of a teamwork, so I really want to acknowledge all the investigators I'm partnering with, and especially all the PIs of the Going Forward project. And I open to take your question.
So thank you, Valeria. On account of time limits, we will try and answer all questions in the panel discussion. And I want to thank you again for sharing your insights from the field of how practically we can incorporate gender going forward.